Now I would like to invite to the stage Tom Olsen, who has been mentoring Heartview Medical.
Thank you very much. It's a great honor, a pleasure to introduce you Heartview Medical. We all know about the heart. It's the most important muscle in the body, the engine. If that engine fails, we are in trouble. We all know that. Heartview have developed, based on a very, very strong IP technology from both US and here in Denmark, a new technology that will give us more detailing, more dynamic view in 3D of the heart. That will enable us to make much more precise diagnostic of this engine. And in that view, it's been a very great pleasure to be mentor and listen carefully to this great team. Thank you.
Thank you very much, Tom Olsen. Today, we do not know exactly how the heart is working. We have patients that are being diagnosed in a non-optimal way, which means again that the therapy chosen is non-optimal. We can change that. With our technology, we have shown things that has never been seen before in the heart. We can change the way that cardiology is taught today. We are Heartview Medical. My name is Marian Andersen. I'm CEO, and we have our data scientist, Martin Vandborg Andersen. Welcome. Go. Apart from myself and Martin as part of the team, we have 2 hardware engineers based in the US. We have a collaboration between Aalborg University and Duke University. Additionally, we have 3 experts within the field of echo to support us, and they're also part of the company. In the middle, you see Peter Søgaard, who is a cardiologist, and then we have Samuel Schmidt, who is our data scientist expert from Aalborg. And to the left, we have Olaf van Ram, who is one of maybe 3 persons in the whole world who is able to define the technology we are working in as of now. Most of us have experience from the startup entrepreneurial world. Many patients will be able to benefit from this invention. First of all, children, because children have a very high heart rate that is difficult to follow today with existing technologies. Secondly, we know that populations are growing older and older in the future. It's always a challenge to society. Even today, 10% of people above the age of 65 develop heart failure. And that number is going to increase. We'll be able to diagnose these patients earlier, meaning a better therapy can be chosen at an earlier stage. Where our focus will be in the beginning will be those patients who have had a cardiac resynchronization therapy device implanted. It actually turns out, even today, that 30% of these patients do not benefit from the implant. So it's a waste of money, and it's not very good for the patients. Today, nobody with existing technologies can show what the reason for this failure rate is, but we can show it.
And the way of doing this is by high frame rate 3-dimensional ultrasound, which will be the ultrasound of the future. If you take a look at this picture here, you see a 3-dimensional image of the heart. And in red, we have colored in what the views you will get with the 2-dimensional ultrasound image. Everything outside that red area you can't see with ultrasound today. And everything in yellow is the areas that are actually interacting when you actually have a contraction, which is a huge problem because you simply can't see it. Not only that, if you look at the speed of ultrasound, what you can see here is a golf ball, of course. And you can see that it's moving, but not really anything else. But if we increase the speed of the image, all of a sudden you get these beautiful details about what is going on with this golf ball, what is happening to it, how it's deforming in time. The same goes for a heart. If you record it at a very high frame rate in 3 dimensions, you get these beautiful pictures of how the heart is deforming as a function of time. And that will be a great tool for doctors to use in the future. Not only that, if you look at an ultrasound image in general, they have fairly poor image quality, which means that in many cases it can be difficult for a doctor to actually find out where exactly in this image the heart is and where there's the blood. One way of solving this is by using a contrast agent, which is an invasive method where you put microbubbles in the bloodstream and thereby emphasizing the contrast between blood and myocardial walls. But that's invasive. What if you could do that in software, like ours? All of a sudden you get the tools for the contrast improvement without that invasive methods. And it gets really easy to find out where exactly in the picture, where the myocardial wall is. Again, a huge benefit for society in general. So tomorrow, what you will see from us is a high-end 3-dimensional ultrasound system recording at roughly 500 images a second in 3 dimensions to get this 3-dimensional image of the heart contraction. Together with this, we'll have software that goes in and uses AI support for both acquisition and also the automated analysis afterwards. For diagnostic purpose, this means that we'll reduce the need for contrast agents for the patients, which in turn will lead to less need for MRI and CT, which will be referred from the echo department. And you free up a huge amount of area that you can use these machines for other patients who will need it. Not only that, if we go back to our CRT candidates, every single year in the US and here in Europe, 50,000 patients get an implant that won't help them at all. 50,000 people. Now imagine if you didn't have to give them that implant.
So our strategy to get into the market will be a 3-step strategy. First step is to sell software packages to tier 2 ultrasound companies. Second step is to work together with hospital cardiology research institutions so that they can get started to find good patient cases that we will use further on. And third step is to go with the volume market, where we will have to find a strategic partner to work with that has the sales network that we need. So first, after 2 years, sell software to existing companies like Canon, Esaode, and before we go out to the volume market, we are looking for partners like Siemens, Medtronic, who are doing something in cardiology but do not have ultrasound. The progression that we've been through over the past 3 months has been tremendous, and seeing is treating. So if you can't see it, you can't treat it. That's the main purpose of us being here. Heartview Medical. We can change the way you treat patients with cardiac diseases. We'll be very happy to introduce you to our new web page that we just launched today, and to see you at our booth. Thank you very much.
Thank you. Do we have any comments?
So thank you. It wasn't absolutely clear, but I assume you use standard ultrasound equipment, but your technology is an algorithm that treats the image. Is that correct?
Yes and no.
Okay.
Initially, we'll develop a software system that will be able to be used with conventional ultrasound systems. And that will be our first approach to getting to the market. Afterwards, and this will be in 2 years where we'll start to get the initial revenue, then in a few years from now, we'll have a fully evolved 3-dimensional high-speed ultrasound system that simply isn't existing today that we'll be able to use. And we'll also produce that as well, yes.
So you would both develop your algorithm and validate in clinical trials that algorithm, as well as developing a brand new ultrasound machine. That sounds like a quite ambitious undertaking. How much do you need? How much investment do you need to achieve that?
We need $30 million in order to get to that point, and we've divided this into 3 different milestones. First one is to have the software solution ready, which will cost a bit more than $2 million, and then another $8 million to develop the prototype, so we're ready to go out and do clinical studies in different parts of the world, and then another $20 million to develop the fully hardware system with the integrated software.
Okay.
And this will happen over 5 years from start.
And did you, in those $30 million, put any funds for commercialization to set up sales, and that all requires investment?
But only sales when it comes to research institutions, because we know that there are other bigger players out in the market, and we're not going as a startup company to set up a global sales network. So at that point in time, we will find a partner like Medtronic, who is well known for doing acquisitions within this area, who have a worldwide sales force, who are in cardiology but do not have ultrasound. That will be our strategy.
And given the time, thank you for a nice presentation, easy to understand, and I'm of course inspired by the efficiency into treatment like the ones you presented here. Any thoughts on that this type of technology could actually be used in other industries? I mean, I could see a tremendous potential in other industries in terms of actually viewing and seeing. So maybe it's a completely different market in
You're absolutely
5 years.
right.
Any thoughts on that?
Yeah, absolutely right, because when the X-ray was developed once, that person, Mr. X-ray, what was he called? He did not know that actually we're using the same technology to scan suitcases in the airport now, right? So we know, of course, you can use this also for other organs in your body. The only thing is the heart is the one moving most fast, right? So, but in other industries as well. It's a completely new technology, so yeah. Thank you.
Thank you very much.